Welcome back, viewers at home. Tonight, I'm joined by quite an interesting guest tonight who goes by the name of Dr. Laila Paruk, who is a psychiatrist at Syntonic Interventional Psychiatric Clinic, a consultant at Chris Hani Baragwanath Hospital, and a board member at SADAG. And tonight she is here as a champion of mental health awareness and advocacy to give her insight on the urgency of addressing mental health in South Africa and the importance of collective action through SADAG's ongoing campaigns and initiatives. Assalamu alaikum, Dr. Jazakallah, so much for joining us this evening.
Wa alaikum salam, and thank you so much for having me.
Now, just to get started on our conversation on us being proactive and really playing our part in that sense, I want to find out from you in terms of how does opening your call center to the media to support the organization's goal of the increasing awareness and understanding of mental health issues in South Africa?
Opening our call center to the media, it offers a powerful opportunity to humanize the work that we do at SADAG and to demystify the process of reaching out for mental health support. It allows the public to see the compassion, the professionalism, and the dedication of our counselors, which helps build trust in the process. It also helps to shed light on the sheer volume and urgency of the mental health needs in the country, reinforcing the importance of mental health services and encouraging more open conversations.
And seeing that such a very robust response to the reasons why media is quite invited to this and the role that they could potentially play, I think for viewers at home who are tuning in now who are still struggling to understand SADAG, what SADAG is about, or they feel like okay, what they read about versus what other people are telling them about is something that really brings about confusion to their mind. Can you please help us understand what would you like the general public to truly know about SADAG's services?
So, SADAG is the acronym for the South African Depression and Anxiety Group, and they offer free, confidential mental health support 7 days a week through helplines and SMS lines. They assist individuals dealing with depression, anxiety, trauma, suicide prevention, substance abuse, and more. They also provide referrals to professionals, community based resources, and psychoeducation. No matter where you are in South Africa, help is available and you don't have to face your mental health struggles alone.
And with that, how can individuals or families who are, struggling with mental health issues really reach out to SADAG? What is that process like? And I'm asking this in case somebody maybe called and then maybe they were told, okay, hold the line, and they took it to say, okay, no, it's one of those things that, we heard through rumors or conversations, for you to just clarify.
So, individuals or families can contact us through our toll free helpline, WhatsApp, or SMS services. The toll free helpline is 0800 456 789. It is a 24 hours a day, 7 days a week service. The SMS number is 31393. You don't need to have a diagnosis to reach out. Even if you're just feeling overwhelmed or concerned about a loved one, SADAG is there to help. The trained counselors provide emotional support, practical advice, and connect callers to other therapist support groups and emergency services.
And
SADAG also has, sorry to interrupt, SADAG also has a website, www.sadag.org, where all the resources are listed.
Interesting. And seeing now that, Mental Health Day is quite a global campaign that everybody really needs to look into, I just want to find out from you, looking at the themes internationally as well as nationally, in your opinion, what is the most critical message that needs to be conveyed about mental health this year?
I think this year, the most important message is that mental health is a basic human right. Everyone deserves access to quality mental health care, regardless of their background, income, or location. Mental health support is not a luxury, it is essential for our overall well being, productivity, and resilience as a society.
And for those who are, still hesitant to seeking help because of the discrimination that's around there and the stigma and the stares that, sometimes it's not even the stares, it's all, in your head because you feel like people can see you going through a depression or people can see you having some sort of mental disorder. What would be your message to them?
That firstly, it's okay to feel unsure. Asking for help can feel daunting, especially when you're struggling. But remember, reaching out is a sign of strength, not weakness. You don't have to have all the answers, and you don't need to wait until things get worse. Start with a conversation. Even just talking to a counselor for the first time can feel like a big relief.
And seeing the support that SADAG is really offering to the larger public, is it possible for different organizations to reach out to SADAG to come in and assist in some way or form, or it's a matter of individuals really need to reach out to SADAG for those services?
SADAG provides services to individuals, to organizations, to communities, to universities, to schools. They have a school-based program for suicide prevention. They offer a support line, a counseling service to university students. SADAG has support groups that span all the mental disorders. There's even a support group for healthcare workers that it's online and that healthcare workers can attend.
And with that, do you think that mental health awareness has improved in South Africa in the recent years, considering that there's so many campaigns out there that are all about trying to demystify the lies and the confusion that lies around mental health issues?
For sure. I think that in South Africa, there's been great strides, especially in the last few years since COVID, which has allowed people to open up and speak about their feelings. More South Africans are speaking up about their mental health, especially young people, and it's now a more visible part of the public discourse. Campaigns, media coverage, and community outreach have all um, helped to reduce the stigma. However, access to care, especially in rural areas, remains a major challenge. We need ongoing investment and awareness to turn progress into lasting change.
And Doctor, in your last response, and I'm hoping this would also give hope to myself and the viewers at home, and this is in regards to us reflecting on World Mental Health Day. What gives you hope for the future around mental health in South Africa?
Um, I think that in South Africa, in South Africa we have a principle called Ubuntu, where we are one because we are part of a community. And as Muslims, we have the concept of an ummah, where we all part of a bigger whole. And both those principles feed into mental health in that we are nobody without each other. And so that is where the hope comes from, because in South Africa that we have a lot to work from and to build on in order to improve the mental health of our country.
And Doctor, all things noted, any closing remarks around our conversation with regards to World Mental Health Day?
What gives me hope is the rising voices of the young people, the tireless voices of mental health advocates, and the communities that are embracing support instead of silence. The principles that I spoke of Ubuntu and Ummah are alive in the way people are showing up for each other in schools, in faith groups, and online. I believe that if we return to these communal values of care, respect, and togetherness, mental health in South Africa will continue to move from crisis to care.
And certainly that's where we all hope to be, inshallah. But Jazakallah so much, Doctor, for joining us tonight and really giving us an insight in terms of, and a refresher in terms of what SADC is all about, and, the purpose of SADC and the impacts of SADC and the hopes of SADC at that. And hopefully this inspires us to want to do better and, push away those loud stigmas and discrimination and really move courageously towards seeking the help that we need. Jazakallah so much for joining us.
It's a pleasure. Thank you for having me.
Viewers at home, that was Dr. Laila Paruk, who was sharing with us in terms of, in case we forgot what SADC is all about. She was really just giving us an insight around that and how really we need to work together in terms of finding a way forward around, demystifying the lies that really lie with the conversation around mental health being a spiritual thing or a witchcraft thing, but more of something that really exists, and we need to work together in helping each other in that way. But for now, let's head over to an ad break. We'll see you just after this.